Kijk daar.
Ja. Welcome. Could you please tell me who you are and why you're here?
Yes, hello, I'm Daan Dohmen. I'm a CEO of Focus Cura Healthcare Innovation. And we are developing all kinds of services, technology services for elderly, chronically ill, to stay at home more independent. And I think, and that's also what we see in the usage of our average age 78 older persons, seniors, is that gaming is very important and also can be used for healthcare as well.
Okay. But quite a difficult market to target with games, probably.
Yeah, well, or not. Because I worked in a healthcare, elderly care facility myself as a nurse. And well, then one day we were traveling together with a woman, and she told me that she really wanted to play games, but she don't have anybody to play games with. She was lonely.
Yeah.
She was not that mobile anymore, so she couldn't go easily to some place to play a game.
Yeah.
So then we found out that using technology is for her not only nice for healthcare, but also for just doing something, playing chess or another game for fun.
Yeah.
Yeah.
Yes, and they have time enough. All the people usually.
Yeah, they have time enough, and they're also more interested. I think that a lot of people think in new technologies. We have now about 100,000 users, as I told, average age 78, using iPad, for example, to stay at home and have care on a distance, do home monitoring for heart failure, COPD, Parkinson's disease. But we also see that they're really interesting in finding out what you can do with these new technologies. For them, new technologies.
Yeah. You were also a speaker here today. What did you speak about? What was the point you wanted to get across?
Well, there were actually 2 points I wanted to get across. One was that, well, as we've mentioned before, that elderly are a really important group. Also looking at the growing population.
A growing group?
Very growing group. And we should think that they are not able to use technologies anymore, because I think they really can. And it's very important for them also. And the second point is that for game developers, for example, you see that they are working, when they want to use a game in healthcare, they are focusing just on the patients. But and that was where my PhD was about last year, was that the caregivers are a very important group, more important than the patients to focus on while developing professional game apps or professional apps for health. Because they are the ones who are telling their patients if they should use it or not. And when you think for yourself, for example, when you go to the doctor and the doctor tells you, no, you should not do that, I think there's a great chance that you won't do it. And when the doctor says to you, well, you should try this out, then there's a very big chance that you will try it out and find out if it's something for you.
Yeah.
And this was also happening in all kind of technology implementations in home care, that not the patients were the ones who don't want to use it, but the caregivers are thinking they don't want to use it, or are telling them that it's not of interest for them. And that's a mistake. So that's also a point I wanted to make today.
So does that mean that you as a company reach out to these people who make the decisions, talk to them, show them, invite them?
Absolutely. And we also try to, I think you should begin small and just try out. For example, when there's a game developer here who has a new game, an idea, just try it out with caregivers, with patients, but keep it small. And then find ID champions you want who are telling about your game and going mouth to mouth, and then make it spread it more and more. But you don't have to start big to make a difference. You just start small and make baby steps at a time.
At a time, yeah. One word that's overheard here a lot. That's the word validation. Is that also playing a role in what you say? Is it important to validate a game?
Yeah.
To convince people?
Yeah, I think it's worth to validate it. It's important for healthcare to see if it works or not. But on the other hand, it's also important to get a little bit of scale then. So first you try it out and you don't validate anything. You're just going to the feeling of the doctor or the feeling of the nurse, because they are the professional and can think about how they can use it. then you are building a larger group, and then you are going to validate that if your goals you want to reach, if they are met or not. But you should not start there.
Yeah.
Just start with playing, and especially in gaming. Don't want to over professionalize and over processalize, or how you say that.
Because what's against that?
There are two important things against it. One is that you get the fun out of the implementation, which in healthcare is, I think, important. And fun is not only defined as laughing about what you're doing, but also about, is my work nice? Am I helpful to my patient? So it's important to make it. The implementation must not be about ICT, which is ugly, which is people are thinking about computers they cannot use, electronic patient records which won't work. No, you have to make it small and in the relationship between the patient and the caregiver. And the second one is that you don't want to give all kind of people reasons for not doing it. So just start. And not try to think about everything before you start with it.
You say you don't want to give people too many reasons for not doing it. Does that mean that there's still a lot of people out there who have doubts, who don't want to do it?
Yeah, and maybe these are doubts which are also reasonable. But there are also a lot of doubts or questions people are saying because they don't know how this technology will affect their own work. For example, we have a medication dispenser, and the first idea is that nurses say, well, then I don't see a patient anymore because it's using a device rather than personal care.
Yeah, and the fun for a nurse is to see patients.
Yeah, but the fact is that when you can translate care from a manufacturing line to personalized care, that these people who can use the device themselves, they can do it themselves, so you as a nurse or as a doctor have time left to give more attention to those people who need it. So cold ICT is enabling warm care, actually. Yeah. And that's another thing, change of mind you have to reach, and but would also mean that with only a nice application or a nice game or whatever, you're not there. It's about a care process in the whole, and it's about a relationship between the caregiver and the patient.
So what does your work, your everyday work looks like? Is it talking? Well,
it's about talking, but it's also about organizing this process. So we say to a care organization, okay, you want to use technology in your process, then you have a product which is care and service, and we take care of the technology and the logistics around it. For example, we have a project in the Radboud UMC which has patients with cancer. And they go earlier to their own homes 3 months by using an iPad with some sensors and another care process and receive care on a distance. And this means for these patients, they can now actually stay at home the last 3 months of their life because they are dying in this case.
Yeah.
So it means a lot on the quality of care. But for us, it means also a lot that the hospital cannot arrange the logistics at the home of the patient. So we are arranging that for them.
Yeah.
And then they can focus totally on giving the care and the service the patient is needing.
How long are you in this business?
Well, I started actually in my own in 2004. And now we are about with 120 people in my company working. And so it's about 10 years. Yeah.
So what has changed during these years?
Well, the earlier days, in the first days, it was, well, the technology was not that good and that easy to use and that stable. So a lot of was about the technology. And the second one was that you really have to convince people. So I was working with big touch screens around from door to door. Will you please use this? Will you please try this out? And now we see more and more that the technology is becoming more available, is becoming more accepted. But the people are thinking about it more, that this is a part of healthcare. And as I mentioned it to home care nurses, for example, I say, well, you have your wheelchair or your car, you have your bicycle, and now you have a video connection or a game or an application you can use as a toolbox for helping your patient more. And this idea is becoming more and more proven, and people are also thinking about it.
Is this nice to reach this point, or does it also Well, I can imagine it because it's now sort of accepted and doors open and people are welcoming it and probably more money comes in and it also changes a lot.
Yeah, it does. And that's why in my company we actually now my role is to talk a lot and to do innovation, because I do that really myself, just in detail. When you think you have a simple application, you have to do it 2 steps more simple.
Yeah.
So that's my role, and I have good people now who are taking care of operation, taking care of logistics, because that's what also changed. We're now with 100,000 of people relying on your technology. You also need an infrastructure which is 24/7, which is reliable.
Yeah.
Which we have installers throughout our country, the country, service and support guys who can be there when there is a problem or something like that. So it's changing, but well, I wanted to become a doctor from this year of age, and now I got the wrong lottery in the Netherlands. You have the lottery system for becoming a doctor. I got the wrong number, but now I can really do things in healthcare from another perspective and really help people. And when you see that people are happy using technologies, less lonely, this is very nice work. For me, that's where it is about.
Yeah. Okay. Thank you very much.
Thank you.